This is the Fix Your Sciatica podcast.
And welcome back. Last week, we pulled back the curtain on the business of healthcare and why I'm obsessed with making it so that you no longer need me or my colleagues. And so today we start a special 3-part series where we're going to get into the front lines of your recovery. And so when you work with me at Dragon Physical Therapy or through my virtual platform, which is here, ifixyoursciatica.com, I don't just care about if you can move, I really more so care about how you move. And this is what I like to call the mechanical audit. Today we're going to be looking at the most fundamental human movement of all, which is going to be the squat. And so if you've been listening to the show, you know that many sciatica pain sufferers are often scared to bend forward and even just sit down. Examples includes bending over to pick something up can result in pain in either your leg or your back or make your symptoms worse. Or even getting in and out of chairs and on and off toilets. And the squat is your solution because it is what I consider the vertical test. It's actually how we are going to be lowering our center of gravity to interact with the world without folding over like a wet piece of spaghetti and irritating your nerve. If you can't squat properly, you are often forced to bend at the spine for everything, which includes sitting on toilets, chairs, car seats, couches, and that constant scraping of the nerve is often going to be why your pain won't just go away. So in my mechanical audit, I'm not just looking for how much weight you can lift or how fast you can squat or how deep you can squat. I am looking at the concept of spinal integrity. And so a good squat is going to start at the level of your hips and not your knees. If your knees shoot forward first and your heels lift up and your back rounds, you are often sending a message, a danger signal to your low back. And this is often due to poor coordination of the hips. And the other alternative is that you can initiate an accentuated arch in your low back that gets more intense. And this is often caused by the fact that many trainers and exercise programs are telling you to arch your back when you're squatting or you have to keep your chest up. You're also going to want to look at yourself in the mirror from the side. And as you get lower, you have to ask yourself, does your tailbone, does your butt actually tuck under your pelvis? And that tuck can actually create a massive amount of pressure on the lumbar spine, especially with loaded flexion. And it could be putting pressure on your spinal discs. And this is called a butt wink. And so if you have disc-related sciatica pain, this tiny movement at the bottom of a squat can actually make things more intense and prevent you from fully healing and having you have those flare-ups after flare-ups. And so one of the other most common patterns I see in the squat is what is called the lateral shift, or a shift to one side. Because the nerve is so sensitive on just one side of your body, your brain will subconsciously shift your weight either to the good leg or away from the good leg, depending on what your sciatica pain cause is. You'll end up squatting like a lopsided person or like a lopsided house, and this often keeps the bad side weak and the good side overworked, or vice versa. So here's today's test. I want you to perform your own squat audit today. Go ahead and grab a chair or bench. The goal is to sit down and stand up without using your hands. And as you go down, take note, do you happen to take a nosedive forward to get momentum, or are you losing position, or you feel or are you feeling a pinch in your low back or in your leg as you transition? What do you see from this side? And then try to see if you can make some adjustments. Widen your stance and try pointing your toes slightly outwards. Push your knees out, lean or hinge forward a little bit more. Does it make it a more pain-free activity, which is what we call the green zone? If it does, we just found a key part of your roadmap. Now, the squat is the foundation of week 1 of my 30-day audit, or the 30-day anti-fragile intensive. We just don't do squats. We audit them to find the exact stance and depth that sends a safety signal to your brain. And once we find that green zone, that pain-free zone, we use it to build up the resilience you need to handle real-life movements. So if your squat feels like a red zone or painful right now, don't panic. It just means that your brain does not trust your hips yet, and we can truly fix that. All you need to do is head over to ifixyoursciatica.com if you want to see what a full mechanical audit looks like. Next week, we're going to be taking a break from movement, and we are going to interview a good friend of mine and colleague, a physical therapist and Pilates specialist. So if you were considering Pilates as a part of your recovery program, this episode you do not want to miss. Thank you so much for tuning in. We hope you got some help from today's podcast. And for more info, check us out at ifixyoursciatica.com. Have a fantastic and pain-free day. No patient-therapist relationship is formed by listening to this podcast. We are not providing medical advice, and all information should be confirmed by a medical provider.